The difference in different companies or the brands of implants comes to the processing, comes to the logistics, the dimensions, and the different surface textures they give to the implants. Hello, I am Dr. Arjun Handa, plastic surgeon and body contouring expert at Handa Aesthetics and Plastics. Breast augmentation is one of the most commonly performed plastic surgery procedures all around the world and at our clinic. The most important factor in any breast augmentation case is choosing an implant along with the patient. So while choosing the implant, it's very difficult to explain all the factors to a certain individual, to a certain patient, and as there are multiple factors involved, it can be confusing and it can be daunting to come to a conclusion. But there are certain points to remember which make the process easier for the patient as well as the doctor. So one of the first points while choosing an implant that we consider is the type of implant. There are many types of implants according to their shape, according to their surface, and according to their consistency. Well, firstly, according to the shape, there are essentially round and anatomical implants. What that means is a round implant is more or less hemispherical, that is half of a sphere, and an anatomical implant is going to be in the shape of your breast. The difference is that while putting an anatomical implant, the placement has to be very precise, because if the placement is even off by a few centimeters, then there's going to be a disastrous result where implant will be visible apart from your breast. In a round implant, we have a more margin for error, because even if the implant shifts by 1 or 2 centimeters, it's not going to make that much of a difference. Round implants are more commonly used, but any kind of implant that is used is not the most important factor. The most important factor is the skill of your plastic surgeon, and that you can determine by seeing his previous preoperative results, previous cases that he might have done, and he will be showing to you. Apart from that, regarding the surface of the implants, there are nano-textured implants and smooth implants. The difference is that with nano-textured implants, the displacement is slightly less because it holds on to the tissues, while smooth implants can move a little bit because they don't hold on to the tissues. And also the rates of something called as capsular contracture and infections is much lower with nano-textured implants. So nano-textured implants are mostly favored by all plastic surgeons. Then we come to the consistency of the implants. So let's say if a female presents who is younger in age and has firm breasts but wants an increase in size, and there is another patient who is older in age, has saggy breast and also wants an increase in size. So depending on that, we choose the consistency of the implant. In the younger patient, we'll go for a more firmer consistency because softer consistency will not really give a natural appearance. And in an older patient where there is not much native breast tissue, a softer consistency will be much better because there is not enough native breast tissue to mask the implant. And if it was firmer, it would be easily palpable beneath the breast tissue. So after considering the different types of implants, we come to the quality of the implants. So as long as your plastic surgeon is using well-reputed brands which offer 15 to 20 years of warranty, along with they tell you the manufacturing date and the manufacturing process of the implant, rest assured all of them are same. They have the same quality because the silicone gel used inside the implant is made by a single company. The difference in different companies or the brands of implants comes to the processing, comes to the logistics, the dimensions, and the different surface textures they give to the implants. But the quality of the silicone used in them is the same, but they have to be well-reputed companies. They have to give you a certified warranty and also tell you the exact manufacturing process so that you can actually trace the manufacturing of the implant, its stock, its date, and where it was manufactured. That is the most important part, but quality of all the different brands that your plastic surgeon uses are the same. So lastly, and one of the most important points that we consider with the patient while choosing an implant are the dimensions and the actual volume of the implant. Now, when patient is choosing an implant with us, it's very confusing for them because there are so many dimensions to consider. Some of them include the base diameter, the arc length, the projection, and the volume. All of these just end up confusing the patient as to which implant will be the best for them. But there are certain methods by which we come to that conclusion and the patient feels comfortable and confident with the certain profile of an implant. The first method is anthropometric measurements. That is, the plastic surgeon actually measures a lot of dimensions on your chest and on your existing breast to determine which implant will be best for you. One of the instruments used are the vernier calipers. So the vernier calipers are a simple measuring tool which give an accurate assessment of the base diameter and also the nipple to the fold distance. These are one of the two most important measurements in determining the size of the implant and the projection of the implant that you will require. After the measurements are taken, the plastic surgeon will be much more comfortable in discussing with you because he will have an idea based upon his experience and his theoretical knowledge as to what range of implants he must offer you. Next comes implant sizes. So each and every company provides breast implant sizes. Now these sizes are in the shape of the breast like this. They are concave on one side and convex on the other side. These are supposed to be put inside your brassiere and with which you can actually determine how you will look with a certain volume of an implant. So these are size 4 breast sizes, which is 150 cc, and a size 5 breast size which is 200 cc. With these sizes, we do not come to a conclusion about exactly the volume that you will require, but we do come to a conclusion regarding the range, because remember, this gives you an estimate how you will feel, but it does not give you an accurate estimate of how you will look. So how you will look is determined by the third method, which is a software. So in the software, we take some clinical photographs and put your photographs into the software, which creates a 3-dimensional model of your breasts. Within the software is a catalog of all the implants available in the market of all the volumes. So we can pick and choose any implant that you like and we can click on that. So what the software does is it enhances your breast as it will look after the implant has been put. This is where all the experimentation can be done, and this is how we determine how the breast will look after breast augmentation with a certain type of implant. But it is also again important to remember, this will tell you how you might look after the breast implantation process, but it will not again tell you how you might feel. So the 3 processes, that is measurements and the surgeon's experience, 2 breast implant sizes, and the third, the software. All 3 in combination will give you an idea about which implant to go with. On each and every parameter, the implant size that you feel most comfortable with will be decided at the end of the procedure. So it is important to remember that there are many factors which go into choosing the right breast implant. What is important is that you clearly state your goals and your desires to the surgeon beforehand, so that he has an idea of what you might require, so that he's the one who is going to suggest you which implant to choose. Then with the help of the software and also the implant sizes, you can actually come to a conclusion if what you stated is what you want. Or you can change your opinion thinking that what you might have thought was probably wrong and then you might need a different implant. But the discussion is absolutely essential. It should take multiple consultations if necessary. It should take as many hours as possible. Because remember again, once the implants are put, to go under a revision surgery is extremely traumatic and the experience becomes a nightmare. On the other hand, if the right implants are chosen, the experience becomes a dream and you can achieve what you always wanted. Thank you.